the only way that you accelerate your healing, properly heal, progress to being stable so that you don't have this reoccurrent injury, and then, being diligent to form those healthy habits and a healthy routine. All right, so here's the deal. Dr. Axel is reacting to too much noise around him, and he doesn't have this little training collar on. So we're just gonna bring him into the action. Maybe we get more views. Here's the deal. Okay. The trauma that happens to the spine when you're injured, the question is, what should you do about it, and should you do anything about it? Because we know that time heals all. Like, this is just a scientific fact that in actuality, the only way your body can heal is at rest. You heard me. Let me say that again for those of you in the back, right? For the people in the back, your body can only truly heal at rest. That's right. Parasympathetic, rest and digest, is rest and repair. That's right. I'll say it again. Parasympathetic, the opposite of fight or flight. You're not in hunting mode now. You're in rest and repair mode, and that is how tissue will actually heal. So when you're awake, you have to think about being on some level of sort of over, because you're always in a balance of sympathetic and parasympathetic, fight or flight versus rest and repair. But when one is really dominant, more times than not, is when you're awake in modern society, okay? That's sympathetic. And then one's really dominant is when you're asleep in modern society, and that's parasympathetic. So that's happening at rest. So what would happen if we never did anything? What would be the actual result of not doing anything when your disc herniation takes place, when your disc, what I call a disc tear takes place, when your ligament sprains and all those bad injuries in your neck or your muscle joint, whatever it is that you think that happened to you, but whether or not you accept like the full, implications of what's happened in terms of the devastation of that injury, what would happen if you did nothing? And what would happen is you would heal inappropriately. And why do I say that, and what do I mean? Well, when you look at the whole human body from side to side, there's this word we like to use, right? It's called symmetry. Nobody is perfectly symmetric. Somebody's eye is set a little lower than one side versus another. Somebody's ear, is set a little bit higher than the other side. If you have wrinkles on your forehead, one might, look a little higher on the right side than the left side. The Rock is famous for raising another eyebrow, right? And those things will form inconsistencies. And it's okay. It's not abnormal. If anything, you're completely abnormal if you are symmetrical perfectly, ears, eyes, nostrils, teeth, side to side. If you are perfectly symmetrical, especially if you've had no what sort of cosmetic or aesthetic work done, like a voluntary type of procedure or surgery, like having braces, like actually doing like a graft to raise one part of your face, if you will, Botox, things of this nature, where you're intervening synthetically to make yourself perfectly symmetrical, if that's even achievable. And the reason this happens a lot of the time from, let's just say, the neck down, let's ignore the face now, from the neck down, other than congenital reasons, what you're born with, developmental reasons. If you start to get injured, or if you start exercising, or if you're always sitting in a certain position, what will happen is you have these things from your body that go from head all the way down to the toe. It's called fascial planes. You may have heard of a book called Anatomy Trains. I encourage everyone to read Anatomy Trains or study up on Anatomy Trains. And that talks a lot about the fascial distortion model, or fascia distortion, these fascial planes. So one will, maybe be from like up here, and then it follows a pattern where it wraps down and goes to the opposite side. And whatever those patterns are, it creates what I call, and something I look for all the time in my clinic when we're studying people's asymmetry, because that's what you have asymmetry, is a tight side and a stretch side. So compressed side and stretch side. There's tons of noise outside right now. It's unbelievable how much honking is going on. So stretch side, compressed side, vice versa, right? Okay. So what happens? Well, you bend and reach too much on the right, and that disc herniation on the right stretches, pops, and tears the disc, or discs, multiple discs, and ligaments get sprained, strained, and all those are what we call a hyperflex or an open pack injury to those joints. And what's going to happen is they're going to heal anyways, like we just talked about. But what they're going to do is they're going to heal with an additional amount of asymmetry. They're going to actually begin to create gristling, as Stu McGill would say, at those disc particles and at those ligaments and at those tendons that are damaged. And they're going to basically heal as any which way they can, but your body, through a neurological firing pattern, is going to really begin to emphasize, oh, that's a open pack or a stretched fiber. And it may be next to impossible, no matter what you're doing, to begin to try to compress and influence that disc fiber or that joint to close, to compress the fiber, to get it to begin to balance back out to the opposite side. So you're not always having this compensating thing going on with your body. One, fear avoidant behavior that you'll actually learn from favoring that spot. Two would be something called, we just talked about asymmetry, but two would be the overcompensation, right? So not only are you developing fear avoidant behavior, but you're just intuitively saying, oh, well, I also know that I'm hurt. And it's not even like I'm going to intentionally avoid. I just all of a sudden notice I'm stronger on one side than the other. And this is very common. That's why you'll actually see people who have hypertrophied, which is big, thick, grown muscle, like hypertrophied muscle fibers on one side of the body, of the back, where they have or have not been injured, versus the other side that's flat and kind of churned off. They just can't seem to engage that. That's a lot of where physical therapy, rehab happens, where the best kinesiologists and exercise scientists in the world can begin to isolate a part. It's never one muscle, by the way. It's really not one muscle. So just take that for what it is. But one region of the body that they're working on, and they'll say, okay, you're not firing that. Okay, fire, turn that on. And they'll kind of cue and tap while you're doing an exercise like a glute bridge, or while you're doing like a split lunge, or even Romanian deadlift or something, where they can then cue both sides of the body simultaneously to engage, to kind of stimulate and turn on the muscle. So these things are greatly affected when you have this asymmetric, one side stretched, one side compressed tissue fibers that are not, we'll just say firing because of the injury, okay? And what I'm really alluding to is you could do just about anything you wanted after you've rested and done nothing, and you can come back and you're still going to have a lot of issues. And the reason I'm saying that is because if you have the fear avoidant behavior, and if your body knows that something is not right, and if you've been compensating and you're not, learning how to, get those firing patterns of those muscles done the right way, you're basically inappropriately healing, and you're actually setting yourself up for we'll just say a re-injury, because that neurological firing pattern knows that there's susceptibility to that joint, to that muscle, to that area. Okay, so what happens, or what should you do at what point to be able to continue to progress with proper care? Is motion medicine? Is motion the most important thing? I just said you're not going to heal if you do not rest, and that rest and repair is where all the healing happens. So why do we say motion is medicine? What is really going on? Is it just something that chiropractors and physical therapists and massage therapists say to get you through the door? I mean, a lot of you watching this will be, oh, of course it is. I purposely make my content the way that I do addressing these things, because that's not the case at all in terms of my motivation. I'm telling you why I exist and I do what I do, and I'm going to explain to you why it would be beneficial for you likely as well. And here's what the deal is. You can go full-blown rest and repair, and everything that I had just said about fear avoidant behavior and asymmetry and the fibers that are open packed or stretched, not really healing right, what will happen is you can't possibly ever heal optimally until you address the injury through a series of what I call patterns that really are progressions towards full compression and motion of that joint. And I will now explain to you what I mean. I'm going to give you the $1 billion secret, not million, the $1 billion secret for you out there. And I really apologize if you can hear this noise out. There's just nothing I can do about it. But I'm going to make this video, and there's just tons of trucks beeping all over the road. Here's what you do. You have passive motion, passive progressive motion, active progressive motion, to active motion, followed by full weight-bearing compression and motion. But really, you can just say the active motion at the end is like a fourth step. The fifth step is just saying you're fully functional, fully healthy, everything is hitting on all cylinders, and you have no deficits. How do you get there? Well, I hate to be the bearer of bad news, guys, but you go to the chiropractor for the passive motion and the passive progressive motion, at least. If you never went to the chiropractor or the physical therapist or the trainer, or to work with someone to do proper like active progressive motion to active motion, compression and motion rehab, you may never quite get to like the peak you want to get to. Like if you're not watching Knees Over Toes guys videos, or you're not tuning into like Thomas DeLauer's podcast to get these types of insights, you just may never get quite what it is you're looking for out of that functionality, away from, just getting, the occasional body work or getting the occasional chiropractic adjustment. If nothing else, a great chiropractor is great at passively treating you and adjusting your spine, because we're taking pressure off the nerves. We're creating a reduced tone in the nervous system. We're allowing a joint that's locked down and trying to gristle and asymmetrically healing. And we're saying, oh, actually, wait a minute. Oh, I can move in those directions. Oh, I can do that much more, or I can be a little better. And the reason that that's happening is because of a endorphin effect. It's a neurotransmitter, pain relief modifying type of stimulus. Your brain knows you've just gotten a reduction in pain by inhibiting pain receptors in the brain, increased range of motion. As soon as the body begins to realize that it can move in an increased range of motion with reduced pain, the body will now have a better chance of healing in a more optimal, in a more pain-free, in an increased accelerated rate of pain type of way. And that's the whole kicker. That's what chiropractic does so well. It gives that brain the sort of that nervous system, that tension release through what we call cavitation or tribal nucleation. That's the cracking of the joint the right way to reduce pressure on the nerves, to reduce pressure in the spinal column, to actually, gap the joint by a few, maybe millimeters at a time. So you have actually more space to start moving around to kind of increase that likelihood of a successful rehab. And that's a lot of what people just simply may not talk about. They want to, I had a person last night who really hurt their back badly. And of course it fit the classic criteria of fatigue. Oh, my back's been hurting for about a week, but I stretched and it felt better. And I just kept going because I have all these workout goals that I have and I'm so busy. And then eventually they went to pick up a box, and a light box. They made sure to emphasize, and by the way, it always is. It's always like a light box. It's always a napkin on the floor. And the back went out and the husband needed to help her get dressed, couldn't take the kid to school. A lot of bad things happen. It's very, life altering. These pains are very life altering. And so they end up coming to me and they need a lot of chiropractic at this point. Why? Because they've gotten to the point that their body is not going to function properly without that type of chiropractic intervention based off of what I've just talked about. And so what it is once you're in that realm, why do I say passive motion and then passive progressive motion? Well, because it's working in actual combinations and patterns due to your specific injury of chiropractic adjustments to make the biggest difference. And then when you're in that active phase, which sometimes takes a little longer for people than they like to get to, because you're not getting 2 chiropractic adjustments at 45 years old. Just throwing an age range as an example, okay? At 45 years old, and you're not going to get on the floor, sit there, and start doing butt walks and curl ins and all sorts of glute and hip mobility drills and holding a kettlebell without your back feeling like it's going to explode. It just doesn't happen. It might happen if you're 22 years old and you have a little tight back and you see, a fit person doing it on TikTok. It looks really good and you might be able to duplicate it. I commend you. That's awesome. I used to be there too. And then eventually you get to the point where your injuries are so great, they're so vast because you've never really addressed them the way you're supposed to and taken the time that it actually takes to be that fit. Yeah, that's right, that fit and functional over the long term on like the back end of what our lifespan is. And by the way, back end doesn't mean you're dying tomorrow. Back end means maybe you're 38 and you started experiencing some pain that's taken, oh, I'm 45, I'm realizing how bad it is. Okay, I'm going to start going to my chiropractor on a regular basis because that's what chiropractic is. You're a Lamborghini, whether you like it or not. Chiropractic is the mechanic. You take care of your high performance vehicle. You do the things you need to do to be able to keep that baby on the road and running well. At least people that understand, that life. And if you just go to the gym and you treat yourself that good, you didn't get the nice biceps, you didn't get the tapered V, you didn't get the abs and the obliques overnight. It took like a year or so of diligent training and proper diet and not eating fucking processed food and all that, right? Well, going to the chiropractor and making that part of your routine for those types of injuries, once you've gotten there, is equally, or you could even say more important because of just function. How are you going to work if your back is that bad? How are you going to work if your neck is in that much pain? How are you going to work if you have pain radiating into your shoulder all day and all night? How are you going to, you know what I'm saying? I could go on. So what you do is you use chiropractic and these combinations and patterns to become a little bit more stable and pain-free to get to the point where you're in that like physical therapy type realm, that self-guided or someone else guiding you type of exercise progressions, to where now you're beginning to do glute bridges, then you're doing weighted glute bridges, then you're doing wall sits, then you're doing wall climbs, then you're doing glute abduction, then you're doing clamshells and dead bugs, and all of a sudden you're back doing a modified sit-up. Then you're actually doing a modified, what do they call that? Like a pistol, like a modified pistol. Then you're doing, a split lunge with heavy kettlebells. Then you're back squatting. You see, there's this progression until like one day you're doing a full blown box jump in a controlled kind of environment or variables that you've taken into consideration, and you can really become full blown functional, right? Weight bearing, compression, motion type active person. And now you're what we call healed. And I know that's a lot of word salad to throw at you about what it takes to sort of become stable, to what it becomes, healed. But that is what happens, and that's the big difference between resting and doing nothing and asymmetrically repairing and possibly not having the function that you want for yourself, for you to feel like you're, at that point of healed. And that's the difference between symmetrically possibly healing better with a greater function and the ability to progress through like active recovery, which is everyone's goal. Your goal every day is to wake up, kind of move your body around a little bit, stretch or whatever it is. If you want to do a full-blown yoga, if you want to go for a 5-mile run, whatever it is, like, eat good, get to work, be productive, feel good, socialize, get home, do it all over again. Like that is what you want. If you say that's not what you want, then you're not really listening to the words that are coming out of my mouth. And you're saying like, oh no, I don't need to do all that. I just want to get up and go to work, or I want to hang out with my friends, or no, I don't get up and exercise in the morning. I go to the gym at 7:30 for my bro time. Like, no. That's not listening to what I'm saying. You can put any which way on the schedule of what it is that I'm referring to. I'm simply saying that can't be accomplished if you have the type of injuries that we alluded to and just talked about for the last 25 minutes. You can't do that with those kinds of injuries. So you have to take that passive to full active spectrum type of progression, right? And that's the only way, because I've seen it over and over again, many, many times in my clinic, as a practicing chiropractor, that's the only way that you accelerate your healing, properly heal, progress to being stable so that you don't have this reoccurrent injury, and then, being diligent to form those healthy habits and a healthy routine, or micro habits that form a healthy routine. And then you go on about your life and talk about how I need to make sure I get to my chiropractor. I need to make sure I get to my, physical therapist. I need to make sure that I get to the gym. I need to talk to my trainer. I need to, watch some updated videos and see if there's any modifications I need to make based off of like my limitations, whatever those may be. Okay. That is, in a long-winded way, why did you get injured and what does it mean? How you combat it if you just did nothing versus how you combat it if you actually did try to utilize chiropractic, physical therapy, exercise. What does that look like? And one thing I'll say in closing here, before me and Dr. Axel get out of here, I'm actually going to put him down and see if he can behave himself for the next, 3 minutes. Hope that is a better understanding of why we get these terrible spinal injuries, neck and back. We'll keep it at that. What is the ramifications if we do nothing? What are the implications, I should say, if we do nothing? And what happens if we diligently apply ourselves to what I have seen over and over and over and over again as the most successful way to combat it? And we've talked about it ad nauseum in this video. So guys, please feel free to share this. Hit the like, subscribe button. All the good things that YouTube likes in terms of the algorithmic success. Please also comment if you like it, if you have any questions, because I want to know what I should make next. Everything that I'm going to be doing is going to be geared towards my patient population and potential patient populations as I look to just expand how many people I can help. Life is short. As far as we know, we've only got one. And I am making it my mission to empower and educate my patients and, of course, make them feel a lot better when it comes to not just chiropractic, but everything I just said, because knowledge is power, and the more of the truth that you shall have will set you free, and your body will thank you for it. All right, and until next time, everybody, it is Dr. Pearlman. Thank you.